schedule your first appointment, Memorial Sloan Kettering Cancer Center. This call may be monitored and or recorded for quality assurance or training purposes. To make sure we connect you with the team best suited to assist you, please choose from the following options. If you are new to Memorial Sloan Kettering and would like to make your first appointment, please press 1. If you are currently a Memorial Sloan Kettering patient or have previously received treatment here, please press 2. If you are seeking general information about Memorial Sloan Kettering, our physicians, or our site, please press 3. Para continuar en español, prima el número 4. If you are a member of Amnesty Direct through your employer or union benefits program, please press 9. To make sure we connect you with the team best suited to assist you, please choose from the following options. If you are new to Memorial Sloan Kettering and would like to make your first appointment, please press 1. If you are currently a Memorial Sloan Kettering patient or have previously received treatment here, please press 2. If you are seeking general information about Memorial Sloan Kettering, our physicians, or our site, please press 3. Para continuar en español, oprima el número 4. Thank you for calling Memorial Sloan Kettering. This is Renee speaking. How may I help you?
Hey,
Good morning. Good morning. I have my girlfriend on the other line where we have a three-way conference call. I want to ask a couple of questions, if I may, please.
Yes, hi. Good morning, of course.
Starting January 1st, I'm retired from the New York City Transit Authority. Starting January 1st, I'm being forced into a Medicare Advantage plan. My girlfriend is my domestic partner, so she's on my benefits.
Mhm.
So, what's the story with you guys and Medicare Advantage? Now, do you accept Medicare Advantage or do you not accept Medicare Advantage?
Yeah, we take Medicare Advantage plans.
You do accept Medicare? Okay, go ahead, ma'am.
What plan is it under? What Medicare Advantage plan is it?
It would be an Aetna. It's supposed to be a PPO, but I'm really not sure.
Yeah. it's a Aetna Medicare Advantage PPO plan. But this is New York City Transit, and according to your website, it doesn't say transit. It says that you have you accept Medicare Advantage plans, but only for a New York City retiree. We're not New York City retirees.
Got it. Let me just take a look.
Yeah, exactly. The MTA is a state agency. Even though people think when you drive a city bus, the city buses are technically state. Yeah. So I really don't work for the, we don't work. I didn't work for the city.
Okay, got it. I'm just taking a look really quick.
Okay, cool.
Medicare Advantage. You said it's a PPO?
Yes.
Correct.
And then Aetna.
Correct.
Yeah, so we do accept that. The only thing when I do it and put the information in, it does say it's the plan. It's a green plan with us, and it's out of network with out of network benefits. So we can schedule in-person consultations only.
That's very important. So it's out of network. Understood. So
The out of network with out of network benefits.
Go ahead. I'm sorry.
This is important, honey. Let her finish saying what she was saying.
Yes. Sorry, yeah. Yeah, so it's out of network, but there are out of network benefits, so there are some benefits. So what I can suggest is just calling the insurance and asking them, like, hey, you're seeking an appointment with Memorial Sloan Kettering. Am I going to be fully covered under the plan? Because it is out of network, but it does have some out of network benefits.
So it would be mostly covered then based on diagnosis code or for consultations, but not for treatment.
But we have to see what the out-of-network benefits are first. So that's why I would call the insurance plans to ask them what are the out-of-network benefits.
And then also, because I don't work within the insurance department, I can give you their number directly, you know, if there are more questions regarding insurance. But what I can see now, just from a quick glance, it looks like it's a green plan, so we do accept it. So it's out of network benefits. So even though it is out of network, there are out of network benefits involved. So it will cover some things here, but just have to find out, you know, through the insurance plan what it will cover. So I will call Aetna and let them know that, you know, you get an appointment here and you were told that it's out of network with out of network benefits. So you want to know what those out of network benefits are and what's covered under that.
I tell you what, how about that phone number you were just gonna give us? That would be a good help.
Yes, absolutely. Okay, so it's going to be 646
Yep,
888
right,
1500
okay.
and press option 1.
Option 1, very good.
Mm-hmm.
And what exactly, which department exactly is this? Is that billing?
Yes, no, that's patient financial services. So they deal with insurance.
Patient financial, very good.
I have a,
Young lady.
I have one question.
Yeah. You know,
What's, before we go, yes, you said, I misunderstood what you were saying. Was it an agreed upon plan or a green plan? What did that mean?
Oh, green plan. So it means like proceed with scheduling basically because it has some out of network benefits. So you just want to make sure just to call your insurance plan and ask them, you know, and ask to discuss the out of network benefits. And I can also give you our MSK tax ID. They may ask for the MSK tax ID and NPI number.
Okay,
So I can give you that as well.
sure.
Okay, one second.
So I guess you have your plans like color coded or something.
Oh no, we just also green means proceed with scheduling. Red means it's kind of like don't proceed.
Okay, so it means you could schedule it, but the person, the beneficiary calling has to confirm that there's confirmation of coverage is on them.
Exactly.
Okay.
You want to schedule it, and then there's some out of pocket cost or something like that, you know. So you want to just call them first and just make sure that you know that covered, fully covered, and once you speak to them, always be able to call back so we can move forward with the next step.
Okay, perfect. So there must be some notation that you have that transit people are out of network, but those New York City retirees would be an in-network or something.
No, it doesn't break it down like that specifically. It just, you know, kind of breaks it down by the plan. So if it's a Medicare Advantage or the Aetna PPO, it just tells us that information. It doesn't really say like, you know, as far as employment, like that.
So in the New York City, on your website where it says Aetna Medicare Advantage City of New York retirees only, so they would be in network or they're not in network?
So the plan is so under the plan of Aetna PPO, so if it's a New York City retiree, but you still have Aetna PPO plan, it looks like it's good to schedule, but it's out of network, still out of network benefits.
Okay, that's interesting.
Yeah.
Okay, cool.
But yeah, I would please call patient financial services, you know, just to get more clarification and some more information
Wonderful.
regarding insurance plans and stuff like that.
Thank you so much.
Thank you, young
Hold
lady.
on one moment. Oh, you're welcome. I'm just going to give you our MSK tax ID and NPI number, so you can just call the your insurance company and let them know.
Okay, go ahead.
Discuss the out of network benefits with them.
Got it. Whenever you're ready, I'm ready.
Okay, I'm just looking for it. Wait 1 minute. And are you looking for an appointment in New York City, New Jersey, or Westchester? What location are you looking to come to?
Initially New York City.
Okay, so the tax ID is going to be 131
Yep.
624 082.
131-624-082.
Mm-hmm.
Okay, and NPI.
Yep. 1700
Yep,
887
right.
411.
I'm sorry, to begin again, 1700-8874-11.
Yes.
Thank you, young lady.
Now,
Again, anything
You're
else?
welcome.
are these numbers different depending upon the location?
Yes.
Okay, so I guess we should,
Tax number's the same, but the tax ID number will be different depending on what location you want to come to.
okay, so we can always ask Aetna, that question. And they probably won't need those different numbers, but just ask based on location.
Right.
Okay, cool.
Correct.
Thank you so much.
All right. You're welcome. All right. Take care. Have a
You're-
good Happy New Year.
You're gonna transfer us now to that other number? Or do we have to?
Oh, yeah. Let me transfer you over to Patient Financial Services.
Thank
Hold
you.
on. Make sure you press option 1. You're welcome.
Thank
Hold on
you.
1 second. Of course.
See why it's important to ask?
Thank you for calling to schedule your first appointment at Memorial Sloan Kettering Cancer Center. This call may be monitored and or recorded for quality assurance or training purposes.
To make sure we connect you with a team best suited to assist you, please choose from the following options. You are new to Memorial Sloan Kettering and would like to make your first appointment, please press 1. If you are currently a Memorial Sloan Kettering patient or have previously received treatment here, please press 2. If you are seeking general information about Memorial Sloan Kettering, our physicians or our site, please press 3. Para continuar en español, oprima el número 4. Memorial Sloan Kettering Cancer Center's registration line. Please listen carefully to the following menu options. You are a new patient scheduled
Oh, my God.
to the appointment. Press 1.
Thank you for Financial Services. Maria speaking. How can I help you?
Maria, good morning, good morning. Okay, so I have my girlfriend and my domestic partner on the line also. I'm a retiree. I'm a retiree from the New York City Transit Authority. Now, the MTA, as you probably may know, is the state agency, so I never worked for the city, right? MTA, regular city
MTA?
bus. Right, now, here's the scoop. What I want to know is, Memorial Sloan Kettering is world renowned. I want to know if you guys accept Medicare Advantage and what is the actual story with the Medicare Advantage insurance. My plan would, starting January 1st, 2024, my plan would be an Aetna PPO plan.
Okay. Do you have an account with us? Is this
No,
the
I
first
do
time
not.
calling?
Very
Okay.
first time, very first time.
Okay.
I'm not in the computer.
Okay. Yeah, we should have. So so with your Aetna Medicare plan, we're usually out of network with that Aetna because we're not contracted in network. But since you have a PPO, you have out of network benefits we can access.
Right, but I need to know exactly what you, in other words, I need to know exactly what my options are. In other words, what the insurance company will pay and what they won't pay. Do you have any idea of that?
No, I really don't. To be honest, we don't do estimates here, so we don't know because we don't do the billing. We only financial counsel the patients when they first have an appointment put up with us. We usually just go over the insurance, what they cover in co-pays or co-insurances, whatever we see on the system. But I don't know how much Aetna is going to pay. Because those visits, when they get billed out, they get billed out by the billing department.
Understood. So let me make sure. So you are in fact Patient Financial Services, correct?
Yes, we register patients, new patients, and we financial counsel new patients when they have an appointment. So we just go
Right.
for you on your insurance, if it's in network or it's out of network. And can tell you maybe more or less if you have a copay for the visit or co-insurances for the outpatient facility, but we don't give you like an estimate or how much they're gonna cover and how much gonna be over with.
Understood. Mary Ann, you have any questions perhaps?
So, I think I'm still a little confused. Does that mean that Memorial Sloan Kettering would not be in network for Aetna Medicare Advantage PPO?
Exactly. We're
Out of network.
because he has out of network benefits. Those are the benefits we can access. So if he wants to come here, he would call his insurance and find out what his out-of-network benefit consists of, if it's maybe like a higher cost when it comes to like home insurance, co-pays, anything like that. And the diagnostic also, sometimes diagnostics is difficult.
And so the out-of-network benefits would mean if the plan didn't cover like specific diagnosis codes, we would have to pay for that upfront ourselves and hope to be reimbursed by the insurance company,
Mhm.
correct?
If it's not covered, if it's not covered.
Okay, so I guess our next phone call should really be to Aetna to determine what is our out-of-network benefit
Yes.
and if there's specific diagnosis codes they do cover or don't cover.
Yeah.
Is that's accurate? Okay.
Yes.
So then it doesn't matter. I know you're on your website, it actually says that the Aetna Medicare Advantage plan is accepted for New York City retirees only, which we are not.
Okay.
Is on your website, it says that that was effective September. So I'm assuming that means the same thing, that that's also an out-of-network benefit.
No, it's only because they did a contract with us. And that's why they're in network, but it's only that specific one.
Oh, gotcha. Okay, so transit, MTA, we would be out of network because we're not in that New York City plan. Got it.
Mhm.
Okay, so then I guess our next call, honey, is going to have to be to Aetna to find out, since they've now confirmed with us on several of these customer service persons that where we would be out of network at the hospital, and we would just have to find out what Aetna would cover if we did go there.
Good, very good.
Thank you, ma'am. We appreciate your help.
Thank you very much.
Great New Year.
You too. Happy New Year.
Bye-bye.
Bye.
Bye.
So what do you think about that, honey?
So there you go. In other words, the first were very informative and
Yes.
both agree. So there you go. So in other words, Pete, this is the whole story.
This is why this is important. This is why when Pete Donahue was telling the press that Aetna paid $1.2 million for 127 people at MSK, I think in option 2, I called foul because if you take 1.2 mil divided by 127 people, that's less than 10 grand a person. That's not cancer care. It's not cancer care. That is not cancer treatment. That is consultations, most likely. That is not care.
Well, of course.
So they're lying.
100 grand a clip. You
Yeah.
know that already.
My treatments are like $87,000 a month.
That's what I'm saying. Exactly.
Yeah.
You and I spent some 2 months ago.
We did. So I don't care who went down there. They did not know what questions to ask. They would have said the plan's accepted, but they didn't understand it's accepted for out-of-network benefits only. So there you have it. With Memorial Sloan Kettering, the hospital is insisting, after speaking with 3 separate people, the plan is not in network, that they would have to have out-of-network benefits, which of course Aetna does provide out-of-network benefits in the plan that was provided for transit workers local 100, as well as of course for the one for the New York City plan. And what the TWU 100 keeps saying is our plan is better than the city plan. No, sir, they're both crap. And the reason I can tell you that is both of the plans are contract H5522. It is the same contract number. Ironically, H5521 is the contract that Aetna is in today, which is also the same contract that New York City retirees are in today, that they're the plan that is offered that only about 7,000 people are in. So they can't keep saying the plan is different. Now was better. TW 100 cannot say that the plan is better. They're both crap. So the other interesting thing that they came about today was with talking to Memorial Sloan Kettering and Aetna regarding this plan, was that the plan does have out-of-network benefits that they would have to determine whether or not the plan would accept procedures based on specific diagnoses codes provided by your provider. But if you're not going to know those diagnoses codes or procedure codes until after you're there and after you've had the services, this is not a way to be able to plan what your costs would be in advance. You'd only find out afterwards. Or if you ask the doctor to generate a prospective bill or invoice or charge of codes, what they would charge for. But of course, once they get in and they start doing things and other issues happen, things can change, right? So also determining that Memorial Sloan Kettering and Hospital for Special Surgery under the New York City plan, that there is a specific contract, which we as New York City retirees knew, specifically to cover those two hospitals. In the TWU Local 100 plan for transit, there is no contract for Memorial Sloan Kettering and Hospital for Special Surgery. Special surgery is out of the network, and so is Memorial Sloan Kettering, but they were working with them for coverage. So long story short, neither of the Memorial Sloan Kettering is not in the network. You would have to use them for out-of-network benefits, and you would have to hope that the diagnosis codes would be covered. Now, Memorial Sloan Kettering on that call was crystal clear. They only cover consultations, which is, we believe we have proven that when Pete Donahue from Transit, their comms person, told the press that Aetna had in 2023 paid $1.2 million for 127 people to go to Memorial Sloan Kettering. Cancer care for 127 people is not $1.2 million. It would be millions of dollars. So I do not believe Aetna is covering cancer care. Now, Aetna could also not specifically tell us that they would cover certain things. And when we went towards the end of the call, we specifically asked them about like CPT codes for proton beam treatment for radiation. They said that couldn't give us a definitive answer, but it was specific to specific kinds of tumors. Again, leaves you to medical necessity as chosen by Aetna. So I'm sorry, Mr. Manzilla from Transit Retirees and Richie Davis, you cannot say that this benefit that you have put in place for all of your retirees is not a diminished benefit, because right now, if I go to my doctor and they send me to Memorial Sloan Kettering, I don't have to go through this and spend 111 minutes on a call to see if Memorial Sloan Kettering could possibly, potentially, might be cover my cancer care. I would just go to the doctor and get that care because my doctor says I need it. Have a nice day, everybody. I can't prove this enough. I just can't keep. I mean, we can do this all day long, but if this is what it's going to take, maybe the next call will have to be live streamed on YouTube to be able to show that Aetna Medicare Advantage is not Medicare and it is not an advantage, and it is a pure diminishment of health benefit. And if 111 minutes on a phone call, you can't get a straight answer from your insurance company, and yet I'm healthy and have my wits about me, someone who is sick and infirm and whose family is dealing with stress cannot get those answers in 5 minutes. That's not insurance. Labor should be ashamed of itself. You are diminishing health benefits for your most vulnerable population. Retirees earned Medicare. Leave them with traditional Medicare. Have a great day, everyone.